Hi, my name is Calleigh Foulkrod, and for my scenario, I decided to do some cancer research. First things first, I started learning about cancer. How does cancer happen? Cancer happens when a large development of abnormal cells and diseases spread over your body. Cancer is caused by a gene mutation. Some gene mutations are from birth, but most come after birth. Possible signs of cancer are fatigue, a lump or change in thickness of an area, hoarseness, persistent unexplained muscle or joint pain, unexplained bleeding or bruising, fever, and color change in skin. Then, once I learned what cancer was and how it was formed, I started learning about stem cells. Among the cancer cells, there are a few that are stem cells. Stem cells are the cells that regenerate and reproduce themselves. Therefore, the cancer grows back if the tumor isn't completely gone. There are two different types of stem cells. Embryonic, which is pluripotent, which means they can turn into multiple different kinds of cells. And there's also adult stem cells. There are two different kinds of adult stem cells. One type comes from fully developed tissues such as brain, skin, and bone marrow. There are only small numbers of stem cells in these tissues, which means they're more likely to generate only certain types of cells. There are two different kinds of stem cell transplants. There's autologous, which is when the stem cells are collected from a patient prior to chemo, then reintroduced to the same patient after the chemo. This allows the patient to have high doses of chemo and not kill the cells. There's also allogenic transplantations, which is when the patient gets a stem cell transplant from an unrelated donor with a close genetic match. This is most likely to treat multiple myeloma, lymphoma, and less commonly leukemia. Immune cells can recognize the patient's cells and only attack cancer, but sometimes the donor's immune cells don't recognize the patient's cells and injure the patient. There are some risks for the transplants. After either transplant, the patient has low blood counts and a suppressed immune system, which puts them at an increased risk for infection and bleeding. For this, the patient can get antibiotics or a blood transfusion. Transplant recipients may also experience nausea, fevers, gastrointestinal problems, and mouth ulcers. So there are more kinds of cancer treatments. Here are a few. There's targeted therapy. Normal cancer therapy targets all good and bad cells, but the targeted therapy targets just the genetic mutations in the cancer cell. We don't know how long this will last, though, because the cancer always finds a way to come back. Targeted cancer therapies are drugs that are specifically designed to block the growth of that particular type of cancer. There's also surgical removal. Possible cancer treatments include surgical removal, the use of drugs known as chemotherapy, and the use of radiation known as radiology. The treatment depends on the type of tumor and the stage of the disease. When healthy cells get damaged or die, they get replaced with a new cell. But if the process goes wrong, the growth is damaged and may start producing mutations called cancer. Now for a demonstration. So, right here I have the stem cells. This is a healthy stem cell. You can see it has the nucleus, and it also has this membrane around it with all of these organelles which help reproduce healthy stem cells. And here is what a cancer stem cell looks like. The color doesn't matter, I just added it for you to see the difference between the cells. It doesn't have the membrane. You can't visually see the organelles. It has a bunch of bumps, and the cell that it recreates, it's not what it needs to thrive. Here are the sources that I used for the PowerPoint. Thank you for watching, and I hope you enjoyed learning about cancer with me, and I hope you enjoyed my scenario project. Thank you.